guys, it's Onyademi here and I bring you good news. Have you heard of Ilera Eko? It's all about the well-being and health of all individuals living in Lagos. I'll tell you about it. The Lagos State Health Management Agency LASMHA has come up with health insurance scheme known as the Lagos State Health Scheme (LSHS) to ensure that all the people living in Lagos have access to quality and affordable health care. Yes, you heard me right. Everyone in Lagos. So we are out here on the street of Lagos to educate people about this scheme and to catch crews like we normally do. So come along with us because this brand promises to leave no one behind. Let's go. Which do you prefer, going to the hospital or self-medication?
I prefer to go hospital based of you never know what they disturb you for your system. So that they will tell you, even you don't want to buy the medicine for hospital, if you want to go native doctor, you go know what they do.
To go into hospital is the best option because a medical doctor know better about your health and precise. No matter how many you use about local herbs, it may not be like the way doctor handle you.
I would prefer going to the hospital because in the hospital, before any medication, series of tests will be done to ascertain or get to know the source of what is happening.
Going to the hospital for me is better. The doctors will be able to check and know the exact problem with you and will be able to prescribe the right medications for you.
I prefer going to the hospital because when you go to the hospital, the doctor will see you, the doctor will examine you. Then, if if you have an issue, he may send you for tests or scan to confirm.
Going to the hospital is
Why?
well, because self-medication, you might not know what is wrong with you, and but when you get to the hospital, at least there's a diagnosis or pro-diagnosis, as some people call it, and from there you'll be able to know what actually the ailment is. You know, for self-medication, you might actually be thinking it's headache, but at the end of the day, you find out that something like malaria has something to do with your kidney, knowing fully well that your body system is interrelated, and so it's just good to just seek for professional advice.
All those chemists that used to sell, it's not actually all of them that know how to sell the right drugs. So I prefer going to the hospital. It's perfectly okay.
Sure, you don't hear LASMHA before?
They hear LASMHA.
Where you hear LASMHA?
I know say it's a sickness, but me I never see them.
LASMHA.
No.
Yeah, I heard of it. I think last year, while they had a publicity on one of their radio. I heard of it.
So LASMHA no be sickness. LASMHA na Lagos State Health Management Agency.
A scheme whereby the government actually subsidize healthcare scheme, for members of the public. I think instead of you paying out of your pocket, just pay into a pool of funds, then you're able to access free healthcare.
They want a situation whereby good health care is accessible to you, to me, to everybody, to artisans, to market women, to people that work in structural organizations, to everybody that is living in Lagos. They basically want everybody to be healthy.
Sorry for that, based on.
No, now why LASMHA send me to you? They tell me say make I tell you wetin LASMHA be and wetin LASMHA they do.
It's a good plan, it's a good thing, it's a welcome development.
That's good.
So now, as I don't tell you wetin all these people they do, if they tell you say make you bring one person, make the person come enjoy wetin you dey enjoy for LASMHA, who you go carry come?
Mo lè pe àwọn ọ̀rẹ́ mi. Enti bá like inú àwọn ọ̀rẹ́ mi, màá wò pé kí n mọ òun náà lọ kó náà bóyá ká jọ jàǹfààní àbí ká jọ wà ní kí a kàn bẹ́ẹ̀.
My wife, my kids, my siblings, my mom, everybody, just bring everybody in. So that's and if I have a very good friend also, my best friend, if it permits me.
I go still bring my brothers too. No be even one.
My mom, because she has health challenges too. She's still battling with it.
A family member or a close friend who I know that will listen to me. A good friend brings a friend into a good thing when he sees or has an opportunity to.
Every of my immediate family, my friends, colleagues, then I could take a step ahead to inform other people.
I will suggest to my wife and my children and other people around me because while I'm enjoying this, I will let other people to benefit in that facility as well.
It's a good one. I think everybody should partake and enjoy his offers.
Have you heard of Ilera Eko?
Yeah, I've heard of it on TV.
This is my first time hearing them.
Not at all.
No.
On radio, I just hear them passing, but I don't really put my mind to it.
What did you hear about it?
I didn't actually watch it, I just say headline, I just read through it.
Ilera Eko is an insurance scheme whereby you pay a subsidized amount to the government to register. They have accredited hospitals under them that you go to and they will take care of you, like the best care from the doctors, whatever the amount, because of what you've paid and what you are still paying, it cover your hospital bills.
nǹkan tẹ́ sọ yẹn mo ti gbọ́ ń pa ẹ̀ ní táìmù kan bóyá ní nǹkan bíi January ọdún yìí bọ̀bọ́ yẹn ń ṣiṣẹ́ ní àwọn civil servant èmi wá rò pé bóyá ó náà máa yọ àwọn owó yẹn nínú sálárì àwọn pé táwọn bá ní anything ìyàwó àtọmọ ló ní.
So eléyìí kò ń ṣe fún àwọn civil servants nìkan, fún gbogbo àwa tá à ń gbé lẹ́kọ̀ọ́, fún gbogbo àwọn ọmọ Èkó.
You mean Lagos State government is offering this to Lagosians?
Yes, and it's not like the person has to go to school. It's for me, it's for you, it's for the guy pushing truck, it's for artisans, it's for anybody, market women, it's for anybody. What do you think about that?
I think that's a laudable feat by Lagos State government.
I must commend them for that.
It's actually okay and it's perfect. It's worth doing. Health is wealth according to what they say.
If you had an opportunity now to see the doctor for free consultation, what would you tell the doctor that is wrong with you right now?
Since my mama born me, I never go hospital. I think something must be there. So I need to go check based of high blood pressure, overwork. I go follow doctor talk based on I know wetin dey do me. I prefer to carry myself go, make him tell me everything.
If there could be a test that could pick out any fault in someone's health, I would prefer that.
I can't eat. I don't know how to eat that much. I force myself to eat or either take drugs to eat. Facing him will just be the right time to pour out my mind, everything that maybe even if it's not only the tummy that is affecting me, I can just tell him whatever that is affecting me then, apart from the tummy.
Sickness tó wà lára mi ni pé bóyá tí n bá ti ronú orí máa ń fọ́ mi. Ìrònú yẹn náà ló máa ń fa sickness. Tí n bá ti gbé nǹkan sí ẹ̀mí pé mo ní nǹkan tí mo rò, orí máa ń fa orí fífọ́ gan fún mi.
I'll just go for a full blood count, malaria test, or Wilder test, and any other test.
An overall test on my health, as in my blood sugar, my blood temperature. Then, as we are growing as a lady, I want to know if I'm ovulating the right way.
I'm pregnant, so I will definitely see the doctor for my baby.
What is Ilera Eko all about?
Well, Ilera Eko is really what we call the Lagos State Health Scheme to ensure that everybody in Lagos has access to affordable and quality healthcare. So that's really what it's about, to ensure that everybody in Lagos is well. That is essentially Ilera Eko to some extent. The Ilera Eko scheme is designed to make sure that everybody has access to those basic problems of healthcare. So what are the basic problems of healthcare if we look at it? One, it's important that if anybody has malaria, the person gets treated for malaria. If you have catarrh, cold, catarrh, diarrhea, vomiting, those simple things of healthcare. And in some situations, if a person has to do antenatal, get born, of course, it's the joy of every family to give birth to a child. So whether it's normal delivery or what's called cesarean section, the scheme covers that. And even if to some extent you want to whiten their polish their teeth, of course, scaling and polishing, that is also covered. And in some situations, if the tooth is paining them, the person can actually remove it. And of course, for those that are diabetic and hypertensive, we also cover some of the drugs that they can use to actually treat them. So those are the benefits of the scheme with respect to the Ilera Eko plan.
Tell us, how can you ensure quality health care for Ilera Eko?
Okay, so for Ilera Eko, currently, before we empanel a provider to get on board, we make sure they have gone through the regular FMA accreditation. We also go there to check that they reach a minimum standard of quality. And after that, we also put them through orientation programs. We teach them through our treatment protocols, international standards. We also have quality officers in every local government that go around to those providers. They do audits and they check on them, quality assessments, quality improvement plan according to where we feel that there are gaps. So there are constant checks and balances to make sure that the provider, of course there are sanctions also. So because the providers know all these things, they constantly guarantee quality to our enrollees.
How can people access Ilera Eko?
Okay, Ilera Eko can be accessed online through LASMHA.com. You can also visit our office, 17 Cafe Street, Ikeja, Alausa. And then you can also visit any First Mobile Money agent to register and enroll. You can also visit any of our PHC within the local government, 20 PHCs. And then from July 1, you can begin to visit any of our accredited provider, about 214 of them, to also make yourself available for registration and enrollment. Providers are general hospitals, some private provider, as published on our website. Thank you.
If you've never heard about Ilera Eko, it is never too late. This health scheme is for you, it's for me, it's for your friend, it's for your neighbor, it's for your friend's friend. Everyone gets to benefit from this. Get yourself registered to enjoy affordable and quality healthcare today. Love you.